Miss Faith. I will be administering two mixed insulin medication. One will be the NPH insulin, which will be given in a 20 units subcutaneously, combined with an Humulin regular insulin, which is given in 10 units, also subcutaneously. Before I administer or prepare my medication, I'm going to cross-check it against the MAR twice. First, with the doctor's order, and also with the MAR against the, with my medication. And I'm also going to check it the third time next to my patient. I'm going to check for the expiry date, check for the patient history of different medication, and also medicational history and any interactions that might encounter with this insulin. At the patient's bedside, I'm gonna ask for the name and date of birth, and also if they have any known allergens. Before I prepare medication, I'm gonna wash my hands, provide privacy. I'm gonna provide privacy, wash my hands, put on gloves. Now, when I'm also gonna let the patient know some side effects that they might experience, which would be dizziness, drowsiness, blurred vision, and sweating. Now it's time to prepare my medication. Because I will be giving an NPH of 20 units and the regular insulin in 10 units. First, I will start with my NPH. So I'm gonna pull out air, inject air about 20 units, because I'll be taking 20 units of medication from the vial. So I'm gonna also take out 20 units from the air. I'm going to insert the air in the vial right on the floor, staying on the flat surface. For the regular insulin, it's going to be 10 units. So I'm going to draw 10 units of air and insert it on a flat surface into the vial. However, before I injected the needle into the vial, I made sure that I cleaned the top of the vial with an alcohol swab, just to reduce any contamination or prevent any contamination or any interactions. So now I'm gonna pull out my 10 units of the regular insulin. I pulled out my 10 units of insulin, and now I'm gonna pull out the 20 units of the NPH. So the total dose now is 30 units. I'm gonna make sure there is no air bubble, which there wasn't even when I pulled out the insulin, and there still isn't any bubble with the NPH. When administering this, the site I can administer a subcutaneous insulin would be in the subcutaneous area, such as the abdomen, 2 inches away from the navel, and also from the rib cage. I can also administer this in the back of the arm, or also in the anterior thigh. So while I'm administering this in the subcutaneous area in the abdomen, I'm going to make sure I pinch the skin. I'm going to insert the needle in a 45 to 90 degree angle. Inject the medication. And then I'm going to pull it out. I'm going to stay by the patient and make sure that there isn't any interaction, they don't feel any drowsiness or dizziness, or there isn't any side effect. Let them know and ask them how they're feeling, and also letting them know the reason why they're taking this medication, which is for their blood glucose. Now I will be administering the Novolane, and this will be in an 8 unit because my patient's blood glucose is about 253. So I'll be administering 8 units of the Novolane, also in the abdomen area. At first, I'm gonna clean it up. I'm gonna insert the needle. And some side effects for this medication is erythema, hypoglycemia, pruritus, and also swelling. I'm gonna prime it at 1, and I'm gonna put it at my 8 units for the administration. Gonna insert the needle, hold it in for a few seconds, and then eject it out. After administering my medication, I'm going to put the needle part into the needle waste. So I'm going to make sure the patient knows the reason why they're taking the medication and also the side effects. As I previously said, after administering the medication, I will wash my hands. I'll take off my gloves, wash my hands, and I'll go ahead and document the 6 rights, using the patient's 6 rights. So I gave the medication to the right patient, I gave the right medication, the right dose, the right route, at the right time, and now the right documentation, concluding with the side effect that the patient experienced, or whatever interactions, or whatever any objective and subjective result from the medication, and I will sign.